Isn't today a great day for behavioral health? So now we finally have a place that when people get out of jail, out of the MDC, there used to be a bus that used to drop them off, and then they used to just go wherever they would go or wherever they wouldn't go, right? But now what's going to happen is there's this bus that's going to drop them off right here where everybody is standing, and they see this big sign that says Resource Reentry Center. And as they walk in, guess what? They're going to have resources thrown at them. They're going to have people that care. They're going to have access to whether it be food, if they have an addiction problem, if they have an issue with homelessness.
I'm not somebody who looks down at these people and says, boy, I really want to help them. I grew up with these folks that deserve an opportunity, these people who have somehow made a mistake or because of their surroundings were put in a situation where they've had to figure out ways to survive. I tell people all the time that people just don't crawl in the corner and go away when you're looking at living with the systemic problems of poverty, from children, from teenagers to adults. The problem has been is how do we service these people when they come out of MDC?
9 years ago, I joined the county commission, May of 2009. And the first issue that came to my attention was the fact that Bernalillo County Metropolitan Detention Center was dropping people off in the middle of the night on the sidewalk. And this was dangerous. This was particularly dangerous for women. And that became really obvious when we had women come to speak to the commission about being dropped off in the middle of the night with no resources, no safe place to stay, no phone, and walking for miles to get home in the middle of the night. We had tragic incidents where young women died after having been dropped off by our MDC vans.
We are very excited to partner on this project, and we think that this whole effort complements the public safety efforts that the county and the city are working together on, and this really will look to reduce recidivism and improves the lives of the people exiting from our Metropolitan Detention Center. We can't think of anything more important because I believe we all rise or we fall together. We are in this together, whatever your walk in life, but we've got to work together and make sure people have the resources they need to be successful.
And as has been mentioned, the connection is going to start when the detainees are at MDC and will continue here. So this is where our role will play. We will be at MDC, we will be at the Resource Reentry Center, and we will be at UNM providing our services. Many of the recently released individuals are probably our patients. I know they are. Some are individuals who just became ill with a mental illness where early intervention is key. Someone was detained for minor offenses, trespassing, and the reason was mental illness. Maybe it was the first episode of psychosis. Most frequently, these individuals come into contact with law enforcement, not with the mentally ill. They would receive treatment at MDC, but when they're released, if they don't receive treatment, this is going to be major consequences, not only in the immediate term, but also in the long term of the condition.
I'm here today because I have hope, and I wouldn't be here without that. 10 years ago, I had a revolving relationship with the criminal justice system. Ever since I was 7 years old, as long as I can remember, I've lived with the mental illness. I've also struggled with substance abuse issues. This really complicated things for me as far as getting treatment. We grew up in a culture where we don't talk about this, and so we all have that one family member that everybody says, well, that's just my crazy uncle, and I remember these conversations growing up. They don't have been around me no more. I think I'm the object of those conversations now.
So the history has been that they come and they drop them off right here at Civic Plaza and tell them good luck. Well, when you know these folks and you grew up with these folks and you were one of these folks, you know what happens. So we knew as a community that had to change. So it takes action. It takes community involvement. It takes partnerships with people providing services to this community. And today, that's what we're going to do.
And our collective impact here is improved by some of our new services at MDC designed to help former inmates remain stable after they've been released. That includes the methadone maintenance program at MDC, Narcan training and distribution, and our new on-site pharmacist who can provide inmates with 14 days worth of medications upon release. This program, I feel, really hits all the marks, and it is consistent with what we have been doing at Bernalillo County over the last several years to improve public safety.
The city recognizes that transportation is key, and we're delighted that people coming out of MDC will be here, and we're working closely with ABQ Ride to see how the bus connection will be to give those folks a helping hand to get to where they need to go. In addition to our transportation solution, we're working closely on motel vouchers, so that'll be a resource for folks coming out of MDC to have the kind of support they need to really get the hand up to get on their feet.
Today I'm not giving up. Today I'm trying to use that experience to share with others, because I know there's others that go through this. Nationally, 1 in 5 people will deal with mental illness in their lifetime. Here in New Mexico, the statistics are 1 in 4. This is a huge problem in our community, and being able to have the right resources when people need them most, when they're their most vulnerable, will help provide that hope that people need. And I'm just excited to be a part of this today, so thank you.